Good evening. Hi, I'm Dr. Kelly Burkenstock, owner of Skin Body Health in New Orleans, Louisiana and Mandeville, Louisiana. Today I want to bring you an update on the newest side effects and what we just need to know to remain educated about the weight loss shots. Are they wonderful? You betcha. They are. They're preventing gastric bypass, gastric sleeves. They're allowing people to lose 40, 60, 80 pounds when done in the right way. With every promise, with every miracle drug, there also comes side effects. So I need to make sure you're aware of those. And not to be a drama llama, not to bring people down, but if you don't know what's going on, then of course someone can run into these bad side effects and get harmed or hurt. So what I want to bring first and foremost is there are plenty of med spas, online teams, nurses and such that are just selling these products. They're great products. However, they do have side effects. We need to not only know about these side effects, we need to know what to do to address these side effects. So I was on WWL Channel 4 New Orleans just this last Monday, and we reviewed all of these medical opinions. We presented these facts, and I was their medical expert. What we want to review today is the intricacies of what can go wrong. We know what can go right. Those are wonderful drugs, and they definitely help people. But what happens when they're not being monitored? Just like you would monitor your blood sugar if you were diabetic, just like you would monitor your blood pressure if you had hypertension, you have to monitor things if you're taking these weight loss drugs. And you've got to do it responsibly. What do I mean by responsibly? Well, if you're taking these weight loss drugs and you're losing the weight, you're blocking the sugar, the gastric intestinal absorption time is lowered, meaning that gastric emptying is slowed so that the gastric area is keeping the food longer. What do we need to know about that, and what is it doing to our body? Well, one of the things that we know might happen is your pancreas can get inflamed and go to pancreatitis. If you've ever known anyone that's had a pancreatitis, they can be in the ICU for up to 6 weeks and have chronic, meaning long-term nausea, vomiting, diarrhea, and complications for the rest of their life if they're unlucky. Sometimes these things heal themselves. That's great. But if it doesn't, you need to know that this might be on the other end. I've got 3 patients here. Number 1, Mr. Stephen. Amylase was elevated 115, lipase elevated 157. We told this gentleman, please do not go anywhere and get any of these weight loss shots for another month. Let's test again. Make sure your pancreas levels have cooled off. And if they're back within normal limits, then you can restart the program. But of course, you need to be monitored closely. This is one of our particular clients. She's been on this weight loss drug for over a year. This particular, every 3 months we check, this particular time, amylase 155, lipase 73. Those are both elevated levels. So responsibly, you should say, we need to take a break at this time from the weight loss drug. Retest in 2 to 4 weeks and keep testing until those levels are back normal. When they are, of course, you can restart the program. But until then, you would be putting yourself at jeopardy. Last but not least, this was a client. She comes to me for anti-aging, Botox, and fillers, happens to be going to some nurse practitioners, and they're giving her the weight loss shot. That's fine. Problem is, no one's feeling the thyroid. If the thyroid's enlarged, you need to watch out for thyroid cysts, nodules, and cancers, which are a side effect of this drug, whether it's Ozempic semaglutide or Mounjaro tirzepatide. No one was following this client. I drew the blood labs. The amylase was 191, very accentuated. The lipase, 382. She had already paid for her shots, which she was about to go pick up the next morning when I saw her, And I looked her in the eye and said, Elizabeth, if you go pick up that set of weight loss shots from those nurses and you inject it, you're going to be in the ICU. She's a very kind and forgiving soul. I just begged her, please heed the warning. Let's redo your blood work, or they can redo it in 2 to 4 weeks. But we need to make sure you're safe before you inject that drug again. So my message is tonight that these are wonderful drugs. They are miracle drugs. And for diabetics, they're absolutely preventing death, cardiovascular disease, and stroke. But we have to respect them as a drug because that is what they are. When you're taking these injectables, I always tell people, you've got to have a great multivitamin and multimineral, our Skin Body Health and our Vitality. Why? These two things are going to replace the vitamins and minerals that you might not be getting enough of. So our Vitality and SBH bundle is $120, and that's a 3-month supply. We have a buy one, get one for anybody that would like to respond tonight. Our vitamins always have the GMP seal of approval from the FDA. So we're offering them buy one, get one, and we will have them buy one, get one throughout the Mardi Gras season. The point I'm trying to make is that when you're on these weight loss drugs, a lot of times I hear people say, we're skipping meals. I'm not getting in my vegetables because they don't appeal to me anymore. I'm craving sweets, and that's not a good thing. The shots are not making people crave sweets, but perhaps because the tummy is a little bit unsettled or they might be a little nauseous from these weight loss drugs. And yes, that is a known mild side effect. What we know about that and what we think about that is you must take your vitamins and minerals. Because if you get malnourished and suffer from malnutrition, which nobody thinks as an adult in the USA and not a third country can happen, it absolutely can. And you need to be aware of this. So if you don't know anything about our products, please click the link in the description below, store.skinbodyhealth.com. That is store.skinbodyhealth.com. Our website is skinbodyhealth.com. We try to bring up-to-date topics and keep you guys informed on the latest things going on in alternative and holistic medicine. If you've missed any of our previous webinars, our YouTube channel is Dr. Burkenstock Skin Body Health. Please share with your neighbors and friends. My goal is to enlighten and help people. And if we can, then I've done my job. I am a holistic practitioner. I also graduated from LSU Internal Medicine. So I am a blend of Eastern and Western medicine. We're on TikTok, Instagram, Facebook, as well as our YouTube channel. We're here to help. If there's any topic that you might want to hear, please go ahead and send us a message at info@skinbodyhealth.com. That's info@skinbodyhealth.com. So we will be having buy one, get one with our Vitality multivitamin and our SBH multimineral for the next 2 months through the Mardi Gras season of New Orleans, which is going to be mid-March this year. So let's get back. We already know that we've discussed that we can have pancreas issues. We talked about 3 different clients, some that are with us and some that come to us from other med spas or nurses, and nobody's checking the blood work. Also, you have to do a physical exam. Are we touching and palpating the thyroid? Are we examining the abdomen and making sure the pancreas and the gallbladder aren't swollen, inflamed, or painful? When we respect medications for what they can do, and yes, they can do miracles, if we're not respecting that and not watching, our clients can get into trouble. And so my colleagues' clients can as well. I implore you to please, when you're buying these weight loss shots, don't do it online. There's not going to be anybody following you. And if you're doing them in a local venue, please make sure someone is actually examining you with a physical exam and watching your blood work. The last thing anybody wants to do in the medical field is to give someone something that hurts them instead of helps them. Yes, these weight loss shots are wonderful, and we can lose 60, 80, and over 100 pounds. Prevent gastric bypass surgery, which has severe and consequential long-term effects. But we've got to respect that it is a drug. They're great, but it is a drug. You can get intestinal blockages because of the slow transit time. What we have seen is that people that need automatic's probably not the right word, or immediate surgeries. Maybe they've gotten in a car wreck, or maybe their gallbladder has blown, or their appendix has become raw and they've got appendicitis and have to have it taken out. So if somebody needs an immediate surgery, what they're finding is the gastric area or the stomach can sometimes still be full of food even 24 hours after the last meal. So what does that mean? Someone can aspirate. When you aspirate, meaning swallow gastric contents through the windpipe into the lungs, you can get aspiration pneumonia, which is deadly. It will put you in the ICU and is a very, very severe condition. So, if you're going to have elective surgery, we're trying to spread the news because I am on top of these weight loss shots. I am in our anti-aging repertoire internationally, globally. We're keeping up with the literature. And what we know is that the stomach contents are lasting at least 24, if not 36 hours. So if you're going to have plastic surgery on a nose, or on a stomach, on a whatever, you need to know, and your plastic surgeon may not know, that the side effects of these medications are leaving food in our gut much longer than it would ever be naturally, and that you have to have 36 to 48 hours of fasting, or you're at a higher risk for gastric or aspiration pneumonia. Last but not least, we talked about the intestinal blockages. You've got to make sure that you're going to the bathroom. The constipation can bring you to the ER. Also, dizziness and syncope, which means passing out. So we don't know exactly because everybody doesn't have home monitors at home that show whether or not the oxygen dropped, the blood sugar dropped, both dropped, or they got up too fast and the blood pressure dropped. Any of the three can occur, but I personally have had 3 patients that have passed out in their homes. So we're trying very clearly to educate patients. These are wonder drugs. We want to make sure you're safe. And then I'll get calls from people that are going to either online clinics or nurses in the community, and they're just not being followed up on. Take heed, take care. These GLP-1s, known as Ozempic semaglutide and Mounjaro tirzepatide, are fabulous new weight loss agents in the market. And we're using them for their great benefits. But just be smart, be aware of some of the things that can happen on the side effect side. We're also seeing some blood clots, although rare. We're also seeing some vision changes. So with diabetic retinopathy, which is when diabetes causes problems in the retina, we don't know why yet, but instead of that improving, we see improvements in blood pressure. We see improvements in cholesterol. We're seeing improvements in blood sugars. We see, of course, improvements in weight, right? And weight loss. We are seeing worsening of the retina in diabetes in patients that are taking either Ozempic or Mounjaro or the generics, and we don't yet know why. So, it's the Wild Wild West. Be careful. Know what you're doing. Go to a physician that you trust and that's going to follow you. And make sure that you're getting a good quality product and not something online that could be tainted or mixed with other things or even diluted. We're here to help. If you've got any questions, please let me know. I'm Dr. Kelly Burkenstock at info@skinbodyhealth.com. We can be texted anytime, and our texting number is 85727-7676. You can text us at any time. If there's any questions you have, we'll be happy to answer you, whether you are or aren't a client. We do have attendants that answer those emails all the time. Our discount code is Healthy WL, Healthy Weight Loss, Healthy WL. And you can get the buy one, get one on the Vitality and the SPH. So your multivitamin and multi-mineral. Because what we do know is, with any of these weight loss drugs, or really any weight loss plan that you're on, if you're skimping on your good fruits, your good vegetables, your lean fishes and meats, and your healthy complex carbohydrates like garbanzo beans, lentils, black-eyed peas, you're not getting your essential nutrients and vitamins. And that's what we need to keep you healthy. Don't always do this. However, I think it was important enough. We had 2 questions come in about Ozempic face or sallow face. Yes, it is a thing. And it's not just with Ozempic or semaglutide. It's also with Mounjaro, tirzepatide, and really it's with any major fast weight loss, okay? So we also see it with the gastric bypass or the gastric sleeve. It's an important question. I thought enough of it to come back on and answer it directly. Of course, we'll also answer it in our blogs and stuff. Yes, when you lose any weight dramatically and quickly, you're going to have a droop of the face, a hollowing of the cheeks, and you're not going to look your very best. So, what can we do about that? If you're losing it quick and you're not doing your vitamins and minerals, please do your vitamins and minerals. You're going to get saggy. So what can we do? Number 1, we can do broadband light laser, which is a no downtime laser, and it will rebuild collagen and elastin. We can lift things with fillers and smooth things with Botox. That's not a bad thing. So when you were lifted because your face was moon face obese, excuse me, that's not a good look. But it did keep you from looking over wrinkled and over saggy. But whenever we lose weight fast, whether it be from Weight Watchers, whether it be from Ideal Protein, or any of the other things out there, we're going to have a sag in our face. If we lost 1 or 2 pounds per week over time, very slowly, and achieved whatever weight loss goal, that wouldn't happen. But when we're going after something quick and fast, or it's happening quick and fast, yes, we're going to get a sallowing or sagging or drooping of the facial and the neck skin tissue, as well as other tissue in the arms and the legs. As with anybody that knows that has been through a gastric bypass, what can we do about that? What can we do about that? What can we do about that? Facial fillers, Botox, lasers, and we can get individual pictures. We can get individual pictures that show you over time, this is where I was, this is where I can be, and this is my best me. So we can give you back what you had before. Especially, most people have a picture before they started losing weight, and they either say, my face was fuller than I wanted, or I didn't realize how full it was, I just didn't see the wrinkles. Now I'm seeing the wrinkles and the drabbing, and they don't want to see that. So we kind of have a come to Jesus moment. Do I want to look that full, that round? Now I'm looking that draggy, that saggy. Maybe there's somewhere in betwixt and between. For the people that want that full face, we can achieve that with fillers. For people who just want a lift, we can do that with fillers and Botox. And of course, laser. Laser will rebuild your collagen and your elastin. And that always gives a natural, very beautiful look. So worry not. We know you're going to lose weight in the face, okay? And if you're over the age of 40, it's going to have a more impressive, saggy look than it would. Of course, depending on genetics, depending on how much weight we lose and such. The younger folks that are between 20, 35, or 40, they can lose a tremendous amount of weight. And this phenomenon, Ozempic face, which is unfair, because it's really any major weight loss face, is not going to occur. Because you're young enough, the elasticity is still there enough where it's going to reaccumulate, and you're just not going to have that. Much like when you have a baby and you're 23, 25, 29, etc., everything including the stomach area, the vaginal area, everything goes right back into normal. When you have a child, when you're older, later 30s, early 40s, the vaginal canal can remain somewhat stretched out, the hips can remain somewhat widened, and the belly doesn't always re-elasticize, so that you might be seeing some saggy skin and or stretch marks. Much different than the same female has had or would have had if she were 23, 25, or 27. So, thank you for that question. I think it was a very important one, and we've now solved the question of Ozempic face. It's not just Ozempic face. It's Ozempic, it's Mounjaro, and it's any major weight loss plan that we lose weight dramatically and immediately. We're going to have a result on the face, especially if we're over the age of 40. God bless. We wish you well, and as always, you are so worth it.